your patient is very crucial in the medical field. In order to know your patient, you have to understand their needs. You also want to know the characteristics of each patient group. It'll help you interact with them while they're in your care. Also, caring for the patient, showing empathy towards their needs is also another great way. Proper hand washing is included in patient care because you want to make sure you don't have disease spread, and hand washing is the way to not spread it. Infants are afraid of two things: falling and loud noises. So always handle them with care and make sure you do everything properly. Infants, all movements that they make are their reflexes, and they also use their faces for communication. So make sure you have a positive attitude toward them and they'll be happier. In Introduction to Radiology, it states that the Rigoni and Thibodeau law states that most cells are most sensitive when they are rapidly dividing. So you want to make sure that in radiology you get the film correct the first time you do it. By the time the child is 3 years old, they have developed a sense of right and wrong. They have a sense of property and they know what belongs to them. They are able to speak and make sentences and follow instructions, but you might want to have a parent in there just to make them feel more comfortable and so that they can direct their child some more. During this wide span of growth years, the child development includes the concept of self. Love and esteem are very important to this age. They have been integrated into society and have become socialized as they interact with others. They understand the concept of time, so if you tell the kid that it's going to be 1 minute when it's actually 5, they're going to get antsy and they're not going to want to sit there that long, so make sure you tell them the correct time. Communication is relatively easy with this age group since they are older and they can understand. If you encounter a child that has been abused, it is your law as being part of the healthcare to report it. The CDE.ca.gov website says that the teenage years, they're longing for independence but not yet mature enough. They want identity and want to be treated as an adult. However, if they're not over 18, they can't make their medical decisions by themselves. They will need a parent. Erickson's Life Cycle Completed states that 25 through 45 years of age young adults have responsibilities and obligations, family and careers, and so life-threatening illnesses, they may be overly concerned because they do have so many responsibilities and they're looking after not just themselves but other people. So being a good listener while they're in your care is crucial. Middle-aged people, 45 to 65 years of age, settled in life, they may have empty nest syndrome, well-defined values and systems, concerned with maintaining independence and retirement. These people are overall healthy and probably just there for checkup. The CDC.gov website states that life expectancy today is 79 years old. However, the fastest growing population in the U.S. is over 85 years. Many senior citizens suffer from diseases such as osteoporosis, diabetes, arthritis, Alzheimer's, and cancer and heart disease, and many more. They usually want to continue working, and they need to be treated with dignity and respect. They also may need additional assistance because they do move slower and they have difficulty seeing and hearing, so you might want to help them up on the table or just tell them what to do. Many people in this age group are consistently dealing with death and dying process, so be respectful of their needs. Elder abuse is more common. The difference between elder abuse and child abuse is that in elder abuse, you have to have the patient sign a consent form to legally report it. Experiencing Psychology, the textbook, goes through the different diversities of today. We come in contact with each type of people imaginable. Some examples include patients with different types of culture. We need to respect these patients' beliefs because we may need an interpreter also, so make sure those are handy. Patients with addictive drugs or alcohol, we come in contact with them very often. Trauma patients, patients with medical devices, IVs, catheters, oxygen tubes, and much more. We need to be a critical thinker so we can adapt to each type of patient that we see, and always be respectful and courteous and professional with every type of patient. Thank you.